Hello everyone, I am Dr. Tanaji Wagmode, Phaco surgeon from Sangli. In this video, I'll be demonstrating phacoemulsification in small pupil mature cataract with pseudoexfoliation. These cases are challenging because of weak zonules, brittle capsule and limited pupil size. The key is to stay gentle, controlled and avoid unnecessary steps. After making the main incision and side ports, I am staining the capsule to improve visualization, as this is the mature cataract. The dye is then thoroughly washed out. Antechamber is filled with viscoelastic substance to maintain the AC and protect intraocular structures. For capsulorhexis, I am stabilizing the eye using viscocannula. Because in PXF cases, zonules are weak. I am performing capsulorhexis very gently and slowly. The capsule is brittle, which makes these steps difficult. I am using cystitome to complete the capsulorhexis. Despite the difficulty, an adequate size capsulorhexis has been achieved, which is essential for phaco and IOL implantation. In this case, because it is small pupil mature cataract with PXF, I am avoiding hydrodissection, as I don't know the status of posterior capsule. So I am directly proceeding to phacoemulsification. As I introduce the phaco probe with bevel directed downwards, I begin by removing the loose cortex. This helps in exposing the hard part of the nucleus, which is essential before applying chopping technique. I am emulsifying the nucleus using direct chop technique. Initially, in Phaco 1 setting, I am making a small pit in the nucleus, then shifting to Phaco 2 position. I divide the nucleus into two halves using dialer. As you can see, nucleus is now divided into two halves. Because the zonules are weak, I am performing bimanual rotation very carefully and separating the nucleus through and through, as the posterior nuclear fibers are still attached. The posterior plate of the nucleus is now separated. Each half of the nucleus is further divided into smaller pieces for easy and controlled phacoemulsification. I emulsify one half in the center of antechamber. Avoid undue movement to reduce stress on zonules. The other half is similarly chopped and emulsified. The phacoemulsification step is now completed. Now I remove the remaining loose cortex using bimanual irrigation and aspiration. Because of weak zonules, cortex removal is done using tangential movement, which helps to protect zonules. Using hydro, I remove the remaining cells from posterior capsule. Next, I am implanting the hydrophobic intraocular lens under irrigation. The IOL is rotated and dialed gently using bimanual eye, and I ensure that IOL is well centered. Finally, the case is completed by hydrating the ports. The crux of this case is that a small pupil mature cataract with PXF can be safely managed without hydrodissection and without pupil expanders if the surgery is performed gently and step by step. Thank you. For any queries, please leave comment below.